Hi there, welcome to the inaugural episode for Amaize Health. I'm Dr. Thorpe Amaize, board certified family physician, clinical informatician, speaker, and so much more, and I'm so happy to have you join me today. I'm excited that I have the ability to start these discussions with you. But first, a little about Amaize Health. It is a healthcare and informatics consultant company. However, these discussions are designed primarily to address healthcare and more specifically, health education. This is an area dear to me because I've had so many friends, neighbors, and patients complain about not having enough time with their doctor or simply not understanding what happened during the appointment. So, let's talk about health literacy because that's in essence what we're talking about here. According to data from the Department of Health and Human Services, National Assessment of Adult Literacy, only 12% of Americans have proficient health literacy skills, and 14% is below basic proficiency. But what's health literacy? It's defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions, which pretty much means getting and understanding the information you're given enough to make an informed decision. The Center for Healthcare Strategies state that there's a disproportionate rate of health illiteracy found among lower income Americans, which pretty much means that individuals with low health literacy experience greater healthcare use and costs compared to those who are proficient. So you may be thinking that doesn't apply to me, but know that even people with strong literacy can have health literacy challenges, such as someone who's diagnosed with a serious illness, who are hospitalized, scared, or confused, or they're simply just not familiar with medical terms or how their bodies work. So, Amaize Health is here to educate you, which means improve your health literacy so that you can not only make decisions, but make educated, informed decisions for you and your loved ones so that you can live longer, healthier, amazing lives. In order to move forward, I believe we have to be honest with ourselves. There is currently a level of dissatisfaction for both doctors and patients alike in today's healthcare system. And part of Amaize Health's goal, my goal, is to help improve both patient and provider satisfaction. This will require examining ourselves, which some of us may not want to do, but we all know it's necessary. This is just part of the journey. The discussions here are not to replace ongoing discussions with your doctor or your doctor's advice or recommendations. This is to be an adjunct to your doctor. I know many of you, after leaving the doctor's office, like I mentioned before, feel like you didn't have enough time to discuss all you wanted to, or you wanted a little bit more education on some things. Let's start discussing and see if Amaize Health can help you. So we're going to start with today's topic, which is preparing for a doctor's appointment. Now, I know some of you are thinking, why is this even a topic? But you'll be surprised to know that not everyone is prepared, and I wanted to lay the foundation for which we can build on. So I wanted to start with preparation. And by being prepared, I don't just mean having a list, although that can be part of the preparation. What do you do to prepare for a doctor's appointment? I'm going to talk about the different scenarios in which I primarily see patients: primary care, urgent care, or via telemedicine platform. So first, let's talk about seeing a primary care doctor. And this one is the closest to my heart because I like establishing a relationship with my patients. If it's your first appointment with a new doctor, bring all medications that you're taking, prescriptions and supplements. Try to know your previous surgeries and at least immediate family history and allergies. You will be asked about this and so much more. If you were provided with a new patient packet, like many offices do, It would be helpful to complete this prior to the appointment, as most of the information being asked will be the same. This information helps us to get to know you more, get to know your health history, and determine some of the evaluations that may need to be completed. Can you be seen and evaluated without this? Absolutely. Is it the best way to do it? No. Now, whether it's your new doctor or you've known your doctor for years, if you're on a new medication, we need to know. Also, it's okay to make a list like many people do so they don't forget to bring up something that's been of concern. However, if your list is longer than 3 items, you will likely need more than one appointment. So please note the 3 most important things, as your doctor will have items of importance to review and address also. Now, these may be the same as yours, but in my experience, it often is not. Just remember that your doctor has a limited time in which they have to evaluate you, and based on time constraints set by various organizations, that can be anywhere from 10 to 20 minutes. The time issue is a source of contention for doctors and patients alike, so we'll have to discuss that further another time. So, back to the list. Along with the list, as mentioned before, any prescribed medications by someone else should be brought in. Even though you may feel or think that it should all be on the computer, it's often not. If you were seen at an emergency room or urgent care for an acute issue or started on another medication by a specialist, we may not have those records. Also, do not assume that your lengthy chart has been read thoroughly if you're seeing a new provider. While some providers may have the time to review, many of us do this on our personal time, so please be mindful of this. When you're seeing a doctor in person, please take the time to practice good hygiene if you're able to. When I was growing up, I remember being told to make sure my underclothes were clean before seeing a doctor. There was a certain level of respect. So these days, it seems that no one really cares about that anymore. And I understand that we're in a different time, but respect for others should be across the board. But practicing personal hygiene is not just having respect for others, it's also having respect for yourself. Now, when seeing a doctor in an urgent care setting, please remember that they often do not know or have your medical records. So this is another situation in which you need to bring in your medication list. This will help to prevent medicines from being prescribed that may interact with the ones you're already taking. So while there are advances being made to reconcile those lists, we're not fully there yet. So please be transparent with the medications and supplements that you're taking. Not all urgent cares are created equal. Urgent care centers are intended to provide care for acute problems that are not emergencies. For instance, a sore throat, an upper respiratory infection, a UTI, a GYN concern maybe, a sprain or strain, those type of things. Most urgent cares will have an x-ray machine and they do basic labs. But many will not have more advanced imaging such as a CT scan. So some urgent cares will see more complex patients, but the level of complexity varies based on who is on staff and what tools are available. Please keep in mind that things like potential heart attack or stroke require a higher level of care and need to be seen in the emergency room. On the other hand, if you've had a problem for a year, 5 years, urgent care is not the place to have that addressed. You need to see a primary care doctor. You may feel like you're being sent from one place to the other, but sometimes that occurs when you're not seeing the right type of doctor for your concern. Chronic, long-term medical problems such as high blood pressure and diabetes are managed by primary care doctors. Simple acute problems, as I mentioned before, can be managed at an urgent care, or if you're able to get in to see your primary care doctor, they would be able to manage that also. When seeing a doctor via telemedicine, please remember that this is a convenient way for you to see a doctor without coming in person. Therefore, please treat it like it's a doctor's appointment because that's exactly what it is. That means turn your light on, sit up, have your face in the camera, and be prepared to show the affected area for a rash, for instance. The evaluation is already limited by being online, so be prepared to participate in the appointment as best as you can to aid in the diagnostic process or help to determine what's wrong. You should not be driving because that's a hazard. You shouldn't be cooking, laying in bed, playing a sport, or have minimal to no clothes on. These are all things that I've experienced while doing telemedicine. Remember, this is a doctor's appointment. Treat it as such. Telemedicine is a great way or a great place to ask questions. But again, unless this is offered through your primary care doctor, GYN, or specialist doctor, your medical records are not available to the provider, so you will have to give a brief medical history. This again is not a substitute to having an in-person physical exam annually or when necessary. So, we've started off with how to prepare for a doctor's appointment. Some key takeaway points are, when seeing a primary care doctor, bring in your medication list, if there are any new medicines, and minimize your list of concerns to 3 items. If you have more concerns, you will need another appointment. For urgent care, you also need to have your medication list available, and for telemedicine. For telemedicine, please be sure to treat it like a convenient in-person appointment, ready to show your face on camera and to show affected areas. Thank you again for listening to these pointers. You can view the health literacy source information discussed today by connecting directly to the websites below. Come back again next week and we'll continue the conversation on our journey to amazing health. You can connect with us on social media platforms such as Twitter and Instagram at Amaize Health or the website amaizehealth.com. I will be discussing various health-related topics on this YouTube channel, and as you listen, be sure to like and subscribe. This is Dr. Thorpe Amaize with Amaize Health. See you next time.